Gukua kwa arigitani anana kumana na murimu wa COVID-19 gutumite arigitani meyumirie gwikia matata mao maria marurumuritwo ni gikuo kia mutungati umwe wa arwaru uria uikaine ta Maria Mawor.
In a span of 5 months, we have lost 3 nurses who dedicated their lives to fight the COVID-19 for the sake of our country.
It is a very huge concern that somebody like Marianne, who was heavily pregnant, was put in the front line and she was giving services in a very high risk area.
Atungati a arwaru marauga mari na maundu maingi thirikari etamahingiirie niguo mahote kuruta wira wao wa kurumbuia arwaru na makiria COVID-19 kihinyio.
It's very, very unfortunate, if not evil, that some procurement officers are still procuring substandard PPEs and are giving them the healthcare professionals.
Maya magioka orire namba ya arwaru ethiete na mbere na kuongerereka na gukinyeria arwaru 22,000 magana matano ma 97.
Today we report 544 people who have tested positive after testing 2,653 samples. This now brings to 22,597 the number of positive cases.
Ministry ya ugima wa mwiri irauga kimera giki kia heho nikiracungiriria kuongerereka kwa namba ya arwaru na Kenya ni magiriirwo ni kwambatiria thogithi hari kwigitira kumana na murimu wa COVID-19.
Dressing warmly to avoid any triggers, keeping social distance to avoid respiratory infections, wearing a mask, which is very critical, especially in reducing transmission of infected droplets.
Mirimu ya heho mingi yayo iria ikoragwo na dariri hanaine na cia COVID-19 ithiete na mbere na kuiga andu aingi hatikaini ya gufunja mawatho ma COVID-19 makigeria kwigitira kumana na heho na hau niho mari na ugwati makiria wa kurwara COVID-19.
Whereas it is important to keep warm, smoke can as well trigger allergic and asthmatic attacks, worsening the situations of persons suffering from those conditions. On the other hand, a poorly ventilated and confined room is a perfect setting for the spread of respiratory infections such as influenza, tuberculosis, and even COVID-19.
Aria mari na mirimu ingi mbere ya kunyitwo ni murimu wa COVID-19 mathiete na mbere na gukorwo hatikaini ya kwaga kuhona wana manyitwo ni murimu uyu.
Amongst these 13 that we lost, 10 of them had some of them multiple underlying conditions. So only 3 of them that did not have any underlying condition.
Gukinyeria riu makiria ma arigitani 600 nio marwarite murimu wa COVID-19 guku bururi-ini. Kuongerereka kwa namba ya arigitani aria mararwara murimu wa COVID-19 guthiete na mbere na kuongerera haho kuri thigari ici cia bata bara-ini ino na riu maroria thirikari ihuthire icoka ciayo kumagitira niguo onao mahote kugitira a Kenya. Ngiribotera Inoro TV, njitagwo Gathoni wa UNGÉTHEIRE.